right, ladies and gentlemen, welcome to another episode of Women's Health Today with Dr. C. I'm Dr. Leroy Campbell, also known as Dr. C, the Women's Health Doc. All right, ladies, so let's skip to it. Let's talk a little bit about heavy menstrual bleeding. That's what we're going to be talking about, heavy menstrual bleeding or heavy periods. And we're going to identify a couple of things. We're going to be trying to answer three main questions, I would say. The first is, what is a heavy period, right? How do you identify whether the period is heavy or not? The second thing is, why is it important for us to really talk about this particular topic, this particular issue? And then thirdly, we are going to look at the varying causes. And hopefully, as I look at those causes, we can get some information that will allow you, when you're assessing your own situation, to have a clue as to what might be happening in your particular situation. Okay? All right. So remember, what we're trying to do now is to help you to be empowered with knowledge, and that will allow you to help yourself, but also to help others. So let's go through this. Let's do this. Okay. So the first question is, what is a heavy menstrual period? What do we mean when we're saying that someone is having heavy menstrual bleeding? And I think before we can talk about the abnormal, you must first understand the normal, okay? So let's deal with the normal. And when we talk about menstruation, what we're talking about is that part of a woman's cycle where she's bleeding, right? So generally, if a woman is healthy and of reproductive age, she's going to have at some point a regular period where she's bleeding for a few days, okay? This is called menstruation. Now, when we look at menstruation, we have to look at the duration of the menstruation or the period. We have to look at the quantity of blood loss during that period of menstruation. And that will give us a clue into what's normal and what's abnormal. So anytime you go to see your doctor, one of the things that he or she will ask you is, when was your last period? And then from there, they're going to go into how long does the period last, and try to have some kind of quantification as to how much bleeding is occurring during menstruation. So let's start first of all with the duration of menstruation. So typically, we expect a normal period to be about a week, about 7 days. So once we get past 7 days, 8, 9, 10 days going onwards, then that's likely to indicate that the period is longer than normal. And most times, while it's not always the case, a longer than normal period is likely to suggest that you're perhaps losing more blood than you should do during your menstrual cycle. So you're probably having heavy menstrual bleeding if it is that the periods are longer. Not all the time. There are some hormonal conditions that can cause the periods to be longer and light. But generally, if you're going over 7 days, 8, 9, 10 days onwards, you probably should be looking to get some medical attention to at least see what's happening. Okay? So that's the duration. Let's talk a little bit about quantity of loss. Now, from a medical standpoint, we would define heavy menstrual period as losing more than 80 mils or 80 cc's of blood over the course of a woman's menstrual cycle. Now, if you think about it, it's not really practical to say how many mils of blood a woman is losing, because most of the time there is no means of quantifying that with exactitude. Okay, so generally speaking, this information is going to be obtained in what we call a semi-quantitative way, and that usually is going to be looking at the pattern of blood loss as well as the amount or the number of feminine hygiene products, for example, that a woman uses. So if we're talking about the pattern of blood loss, then you're going to have questions being asked. For example, Are you seeing clots, especially if you're seeing large clots, almost like the palm of your hand? They're pretty large clots. Usually bigger than a quarter is considered reasonably large clots. And if you're having, lots of clots whenever you're seeing a period, or you're seeing what we call flooding. And flooding is pretty much where some women may not necessarily be bleeding heavily throughout, but they will have episodes where there is blood that's coming down very heavily. Usually they'll see this, for example, when they're using the toilet. She probably goes to pass some urine, and here comes just this flood of blood coming down. Or during the course of the day, she can literally feel a flood of blood coming down. Sometimes it can be so much in quantity that it overflows, and women may experience, for example, wetting of their clothing. And this can be something that's really distressing to many women who are experiencing flooding. And generally, we're seeing where you're having flooding, and if you're having large clots and so forth, then chances are you are probably experiencing heavy menstrual bleeding. And that's something that you should have checked out. Sometimes as gynecologists, we'll ask about, do you use pads? Do you use tampons? Do you use menstrual cups? For example, how many tampons would you use on a day-to-day basis, or on the heaviest day? Or how many pads would you be using on a day-to-day basis? Or how many in total would you be using over the course of your menses? And this gives us an idea, because we know there's a correlation quite often between the volume of blood loss and the number of pads used. So, for example, we know that if a pad is soaked, it gives us an idea of how much blood is required to soak a pad. And what I'll do, I'll probably put in the description a link to some information, a table that can give you an idea of exactly how much blood each feminine hygiene product is able to absorb or retain. So that way you can have an idea, am I losing too much, or is this normal? All right. So that way we can assess perhaps how many mils of blood, is being lost on a day-to-day basis during the menstrual cycle. So essentially, that is in terms of quantification. The other way that we can define heavy menstrual bleeding, so we spoke about duration, we spoke about quantification. The other way is really based on symptomatology, how a woman feels. Simply because if it is that you are losing a lot of blood during, then quite often it can cause anemia, or it can cause what we call hypovolemia, which is where literally the blood volume is reduced, and sometimes that can lead to decreased blood flow throughout the body. And both anemia and hypovolemia can present with similar symptoms. And generally, these symptoms are feeling lethargic, feeling tired. In some cases, if it's very acute or severe, you can literally have fainting. Some women who have anemia may also experience like headaches as a symptom. So you'll hear when you go to the doctor, we'll ask about these things. And it's really because we're trying to get an idea of how severe the blood loss is during your menses, and how this is impacting your function. Some women experience, in severe cases, even shortness of breath. They feel short of breath whenever they are seeing their menses, and this is because they're anemic. And this is particularly important to ask about, simply because if we miss this, sometimes it can lead to deleterious effects. Can you imagine a woman who is, bleeding heavily? She can faint, she can collapse at work, it can have very significant impacts on a woman's quality of life and functionality. And so therefore, asking these questions are quite important. Okay, so now that we've somewhat defined what heavy menstrual bleeding is, the question is, why is it important for us to talk about? I mean, if you haven't gotten it already, then let's make it a little more plain for those who may not understand. It's important to talk about because it can have significant impacts on a woman's quality of life. Remember, this is an extremely common condition. In fact, heavy menstrual bleeding is one of the most common reasons for women to come to see a gynecologist. It's in fact one of the most common complaints that we as gynecologists see. And so naturally, this makes it important. It's estimated that anywhere between 1 in 3 to 1 in 10 women will experience heavy menstrual bleeding at some point during the course of their life. That's a big number. If you think about it, if it means that if you're in a room with 3 women, chances are one of you are experiencing that. So if you have more than 3 friends, then chances are there's somebody out there that you probably need to be talking to make sure that they're okay and to get the right advice as to what to do. So yeah, so it's common. That's one of the first reasons why it's so important. It's particularly common in certain ethnic groups. There are certain risk factors that makes heavy menstrual bleeding more common, particularly among, for example, women of African descent. So Black women tend to have higher rates, higher prevalence of heavy menstrual bleeding than do women of European descent. And most of that is linked to the prevalence of, for example, uterine fibroids in Black women. All right. So, of course, as I mentioned before, when we talk about the importance of this, if a woman is having heavy menstrual bleeding, she's going to be at increased risk for anemia, which is going to put her at increased risk for functional problems. We spoke about fainting. We spoke about lethargy. We spoke about the fact that it's going to generally cause her to feel unwell, have headaches, and as a result, it's going to affect her productivity and her function. So one of the very common reasons for loss of time from work is actually heavy menstrual bleeding. Many women are unable to work, to carry out their occupational functions whenever they're going through their periods. That's a fact. It's one of the leading causes of loss of productivity in the workforce. And that affects the woman. It also affects her employers. And it also may affect women's ability to remain gainfully employed. Because if you think about it, if you're going to be missing work on a regular basis, every time you see a period, that means every month you're going to be away from work. Then after a while, it's going to affect your employability. So it affects productivity, it affects occupation, it also affects sexual experience. So if it is that a woman is bleeding heavily, especially if it's prolonged, then it's going to affect the spontaneity of sexual experience. And quite often, we find, and certainly I've seen this in my practice, where this has become something that's actually quite disruptive to a woman's experience in her relationship. Because many times, because of the prolonged bleeding, there is not the opportunity for intimacy, and that now puts a strain on the relationship, which then leads to other issues such as infidelity, especially if her partner is not particularly supportive. So you can see that this is something worth talking about. It's something particularly important, and I'm so happy to get the opportunity to share on these kind of issues, which is why I'm taking the time to do what I'm doing. Okay, so we answered the first 2 questions. We said the first one we're going to define. The second one, we're going to be talking about how important this is. And the third thing we're going to be talking about in this video is to look at what are some of the potential underlying causes. So if a woman is experiencing heavy menstrual bleeding, what could be the possible cause? And so let's get to that. When we talk about the causes, it varies. You can be dealing with issues that are local to the genital tract, meaning the uterus, cervix, vagina, or it can be issues that are systemic. So let's start first of all with the systemic issues. When we talk about systemic issues, we're talking about issues that are going on in the body that are separate from what's happening in the genital tract. Because the assumption is if a woman is having heavy bleeding, quite often by non-medical persons, the assumption is if a woman is bleeding heavily, then it must mean that there's something wrong with the female reproductive organs, whether the uterus or vagina and so forth. But sometimes it can be something systemic. So I'll give you an example. I recently had a patient who came to see me. Her husband is actually a colleague, a fellow physician, and he asked me to see her. In going through the history, her issue was heavy bleeding. And she previously all her life, pretty much had normal periods, no issues. But all of a sudden, over the last 2 months, she's been having heavy menstrual bleeding. And when I got into the history, we realized that she had recently been diagnosed with a pulmonary embolus after having a long flight. They had gone on vacation, long transatlantic flight, flown to different parts of the world. And of course, sitting in one place for a long time causes stasis of the blood. She developed a clot in the leg, which eventually went to her lungs. And she developed what we call a pulmonary embolus. In treating the pulmonary embolus, her physicians, quite rightly so, had started her on medications that thin the blood and therefore preventing further development of the clot and allowing the body to break down that clot. The issue is, having been placed on blood thinners, it now caused her to be bleeding more heavily. Okay, so her periods got heavier, not because there was really a problem with any of her genital structures. There wasn't a problem with any of her reproductive structures, but simply because she was on blood thinners. Okay, so that's one of the things. Quite often, that's what we call iatrogenic, meaning that it's medication, something that the doctor puts you on to treat one thing that can end up causing a problem elsewhere. Other systemic issues might be, there are some patients who naturally have coagulation problems. So it's not because of any medications that they're on, but they naturally have some kind of disorder that causes them to not be able to clot properly. And so therefore they bleed more readily. And there are a number of different conditions like that. Most common condition is something called von Willebrand's disease, where women tend to bleed more readily. And so, these are some of the things that we check for, we ask about whenever we're seeing patients who are coming in with heavy menstrual bleeding. And that's particularly useful if during the assessment we find that the reproductive structures are quite fine, then we have to begin to look for issues like this. Women with these kind of issues may not just have bleeding during their menses, but they have a high propensity to bleed otherwise. So bleeding from cuts on the skin. And, if you have a little nick that somebody else would not bleed for very long, they lose a lot more blood. Bleeding from the nose, they find that. So those are little clues. Bruising easily can be clues to say that there's some underlying coagulation problem that's going on. Okay. And then, of course, there are hormonal issues that may arise, thyroid problems, issues that can lead to abnormal bleeding. Okay. All right. So we can talk a little bit about the genital causes now, the causes that are local to the reproductive system. And in that case, you can have situations, for example, where you have problems within the lining of the womb, on the inside of the womb, right? Here, this is called the endometrium. Endometrium is the inner lining. And so sometimes if, for example, there are abnormal growths within the endometrial cavity, you can end up with abnormal bleeding. And most commonly, for example, polyps in the lining of the womb, which we tend to see in women as they get older, especially women who are closer to menopause, but it can happen at any age, that may have polyps in the lining of the womb. The other place that you can have issues is within the muscle of the uterus itself, right? So in the muscle of the uterus, you can have abnormalities, and the most common of these abnormalities would probably be like uterine fibroids, right? In the muscle of the uterus. And we can see here in this image examples of what we would call uterine fibroids. All right, let's erase this here. Let's get these marks off the screen. So this is an example of, and fibroids are really just growths, tumors. They're benign, meaning they're non-cancerous tumors that develop within the uterus, from the muscle of the uterus. And there are different types, and depending on the type, it may present in different ways. And in another video, we'll talk a little bit about fibroids, but I just want for now for you to understand that uterine fibroids can cause heavy bleeding, especially those that are closer to the inner lining or the endometrium of the uterus. One of the other common causes of abnormal uterine bleeding is what we call adenomyosis. And adenomyosis is essentially a condition where the tissues that normally line the inside of the uterus, this endometrial tissue, can find its way into the muscle of the uterus. And one of the things with adenomyosis is that when it finds its way into the muscle of the uterus, you end up now having the tissue there. And so each time a woman goes through a menses, that tissue bleeds into the muscle. And over time, it affects how the muscle functions. The uterus becomes bulky and buggy. And so, therefore, it doesn't contract very well. And that contraction is actually what stops the bleeding whenever a woman is having her period. Many women don't realize that the uterus contracts. Yeah. In fact, that's part of the reason why you feel those cramps. And one of the features of adenomyosis is actually that the periods become very painful. And sometimes you may begin to have pains even before the period starts. Generally, that's one of the clues when we begin to ask questions that clues us that somebody could be dealing with adenomyosis. In the case of uterine fibroids, there may be pain as well, but you tend to have what we call spasmodic pain, which is usually pain that precedes the passage of a clot. And remember, we spoke about those large clots and evidence of heavy menstrual bleeding. Well, what happens is that the clot forms when you have large amounts of blood pooling in the uterus. After a while, because the blood is in one place, it begins to clot. And then the uterus senses the pressure building up inside and starts to contract down to push that clot out, and it comes out as a clot. And so you may have pain as uterus is contracting to push it down. And here's some of the clues that we can use. Less commonly, women can have heavy bleeding due to inflammatory conditions such as infections, whether of the uterus, sometimes of the cervix, and also even malignancies or tumors in this area. But usually in the cases of the latter, you're really dealing with something that is not cyclic. So in those cases, you may have bleeding that's not specific to the time, the usual time of the menses. And then you may also have bleeding, for example, after sexual intercourse. So if that is happening, that's also something that you really need to get checked out. We've answered our 3 questions for this video, which is 1, we have defined heavy menstrual bleeding. We have gone through to speak about the reasons why it's important, why it's such, the effect on a woman's function, as well as how common it is. And we have spoken about some of the main causes and some clues as to how we may be figuring which one of these things could be taking place. All right, so I think that's us for this particular video. If there are specific questions that you may want to be answered on this particular topic, feel free to put those in the comments so that we can have some discussions and probably address some of those questions in a later video. Hopefully this was of benefit to you in understanding. And remember that everything that we're doing here is geared toward empowering women to take charge of their health through providing quality health education. So if this has been beneficial, be sure to smash that like button, share this video, and subscribe to the channel for more opportunities to learn and for us to grow together and to together help to make women happier and healthier, experiencing a higher quality of life. Okay, so that's it for me, Dr. C, the Women's Health Doc, for this video, and wishing you a wonderful, beneficial, and blessed rest of your day or night, whatever time, wherever you are joining. Have a wonderful day. Take care.